Hello, my name is Dr. Julie Hall, and I and my nurse Hopi Moore Sargent run Summit Wellness Group out of Longmont, Colorado. Welcome to our intro video. We are licensed here in Colorado as well as 18 other states, and we would love to tell you about our medical weight loss program. So we use the injectable medical weight loss drug semaglutide, which the brand names are Wegovy and Ozempic, and tirzepatide, which the brand names are Mounjaro and Zepbound. Now we use compounded medications from an FDA approved US-based sourced pharmacy out of Florida, and our medications are compounded with L-carnitine, which helps weight loss even more. And basically these are generic forms of the medications. So both medications are what we call GLP-1 medications. So the way they work is they help the brain balance the leptin and ghrelin. So leptin is the I'm satisfied hormone, and ghrelin, as we call him Ghrelin the gremlin, is the I'm hungry hormone. So for most people, those are pretty out of balance because we never feel satisfied and we always feel hungry. These medicines just get these back in balance. It also helps with the addiction center in our brain, so it helps quiet that emotional eating center. It helps curb cravings for carbs, for sugars, and for some people even for alcohol and cigarettes. And then it also slows the stomach emptying, so you physically get full faster. This can also lead to some of the side effects because sometimes if you eat too much, you can get pretty nauseated, or there can be some constipation. A few people have diarrhea, but we do see more people with constipation. But the medicine has also been found to help in the body a lot of other places. It helps lower blood pressure, not only from the weight loss, but also just because there's GLP-1 receptors in our blood vessels. It helps, which was what the original plan was, is to lower the A1C, which is the 3-month rolling average of our blood sugar. The cool thing is that for those of us that are not diabetic, it lowers the blood sugar without going to a danger zone. Both Hopi and I wore a continuous glucose monitor for the first couple of months while we were on the medicine to ensure that our sugars were fine, and they indeed were. Some people are coming off of their blood pressure medicines, off of their cholesterol medicines with this medication. It's really amazing. This is a weekly injection with a subcutaneous injection. So that means it's a tiny needle just under the skin. In the office, oftentimes we'll give them injection in the back of the arm. At home, a lot of people give the injection in their belly or in their thigh just because it's accessible and right there. Although a lot of people are a little nervous about their first couple of injections, they realize that it really doesn't hurt very much at all. Some people can't even feel it, and a lot of people even learn how to do the injections themselves at home. So we want to just put together some introduction videos that just talk about the different components of these medications, how they can benefit, things to watch for. Again, there's two medicines, semaglutide and tirzepatide. The tirzepatide is also the GLP-1, but it has a second component called GIP. There's no test about any of this. And that actually makes the medicine work better with fewer side effects. So the only reason why the people don't start on the tirzepatide right away is because there is a little bit more expense to that one, because the medicine is a little bit more expensive, but it does definitely work better for most people with fewer side effects. So stay tuned for the rest of our videos about side effects, what to watch for, how to taper, and we'll go from there.